An email from Tia in Albany, and Tia writes, "Dear doctors, I get cold sores all the time. I hate it. How can I treat them or avoid them?" Well, Tia, you're not alone. Cold sores are predominant almost everywhere. We've got an animation to show you what's going on with these cold sores. They do commonly occur in clusters around the corners of your mouth, and it is caused by the herpes simplex virus. This virus actually lives in your nerve cell, and when it gets reactivated, it develops sores on your mouth. It becomes very painful. Now, the issue is they can be contagious even when you don't have an outbreak, and sometimes you'll have the pain before you ever have a blister. So the key to prevent them, if you don't suffer from them already, is you really don't want to share spit. You don't want to share toothbrushes, utensils. You don't want to drink from the same glass with someone if they're having an outbreak, because then obviously you're at risk for catching the virus.
Right. You know, certain people, I've never had a cold sore. It's just my immunity.
You know, I see them a lot, and even kids, they get the little outbreak inside their mouth. And it's funny, most of those kids, it does not become that recurrent problem. I think some people are just able to kind of fight it off and it goes away.
So one thing you can do is you can actually, replace the toothbrush after you've had an outbreak. You can use these smaller size toothpaste containers because these can actually transmit the virus.
Because you're touching your brush when you put it on there. Never thought of that.
And what I tell my patients a lot is, put some ice on there. Again, this is the cold to hot. Put the ice on there, and that'll, decrease the inflammation and the swelling. And
it is a hot-cold show, so that would make sense.
There you go. Now, these aren't hot or cold, but petroleum jelly or aloe vera on the cold sore can kind of keep it moist, keep it from cracking, because if it's cracked, it can get a little infected. Yeah. Some of the over-the-counter remedies help protect the tissue around the cold sore to keep it from spreading and might even make it heal up a little faster.
And actually, you may want to, if you're having an outbreak, avoid arginine-rich foods. That's an amino acid that's found in chocolate, sodas, nuts and whole grains, and even beer. But the good news is I'm actually not having an outbreak right now.
So you're good to go.
Could I have some beer?
Nice. Drink away, huh?
There you go. Cheers.
And since you don't have a cold sore, we could share
that
drink, right? Because I don't have a cold sore.
And
nice.
You good? All right. This is a hot-cold show, and that beer's hot.
Yeah, it's a warm beer.
That's why I passed.